Well, good afternoon on the holiday weekend on Saturday, and as I mentioned, Dr. Yaffe is taking today, this afternoon off, and she'll be doing the media event on Monday. We won't be doing one tomorrow on Sunday in that. So we're looking at the numbers on this weekend. As I said, we've been trying to ascertain how we're doing with flattening the curve, and so I will be giving you the numbers, not Dr. Yaffe this morning, or this afternoon, I should say. So let's look at those and see how that goes in the context of where I think we are at and how we're doing on the overall aspect of our physical distancing in that. So right now in Ontario, we had another 411 confirmed cases from our previous report. That gives us a total of 6,648 confirmed cases of COVID-19 in Ontario reported through our integrated public health information system. Again, the percents are fairly consistent with before, slightly more percent female than male, and about 38% are 60 years of age and older. Most are in the Greater Toronto Area, 53.4%. We had unfortunately, another 31 deaths reported since the last report. That puts our total in Ontario up to 253 deaths reported at this time. We have 79 outbreaks in our long-term care facilities and 109 deaths related to those outbreaks. So you can see they make up a large proportion of our deaths here in Ontario. We continue to see lots of cases resolving. So we're now at 2,858, heading to 3,000 cases resolved. That represents currently 43% of our cases. In the healthcare workers, our cumulative over since the end of January is 744, and so we're not sure how many are really at status of active and how many are resolved at this time, and we're hoping to get some more detail, and I would call the term segmentation of that data as we go forward in the future. In the hospital, we have 691 patients admitted with the diagnosis or working diagnosis of COVID-19. That's an increase of 18. We have currently in the ICU 257. That's a decrease of 3. And patients currently in ICU on ventilator, that's 215. That's a decrease of 2. And I think that's important as we look at the other numbers. What does that tell us? We were anticipating that during this week we would continue to see a climb in our ICU numbers, and at times almost doubling since we heard from the modelers about a week ago. So that doubling has not occurred. I think this amount of drop is not significant, except the fact it didn't increase. And so these numbers like -2 or 3, the flow through in ICUs is, on both the categories of ventilators and otherwise is so robust, you can't really say 2 or 3 means. More like it stayed the same and plateaued in that regard. So right now, with all our testing done, we've done 96,321 tests, people tested, and on our list of pending, the total between all our labs is around 1,517, which is our daily flow now, and natural numbers that are in the queue to be done that same day. So I wouldn't call that a backlog. The challenge we have is that we had about 3,800 people were tested by our labs that we know of, but there were 6,000 tests done. And as I said before, a lot of those patients in the hospital, while it's one person, may have 2 to 3 tests done. So that adds up the number of tests in that overall number. So as I said, when we look at how we're doing, as you know, when we started this week, I said we're going to be watching and seeing once we get through the travel numbers. As I said there in our numbers in the 411 that we had, 7 of those were still travel related, and the ones from yesterday, another 23. So there still are people coming in and traveling, where we would have thought by now that'd be down to maybe only 1 or 2 people positive in each time frame. So we're finishing the tail of that one off as we go through the weekend here. I think it's important to look as we try to see some optimism on how we're doing, is that on Wednesday we had 550 cases, and then on Thursday 483, and on Friday 478, and today we have 411. I certainly think this is a positive trend and direction, and some indications that some of the test results for tomorrow might even be a bit lower than even 411. So I'm looking at that optimistically, saying we are certainly bending the curve. Whether we've actually flattened it was another question. We're going to get a few more days as we ease out through the weekend and see how we relate on to this number on Sunday and Monday. So again, I think this is a positive thing. Having watched and observed, I can still see people lined up at stores, spaced out, 6 feet apart, people taking their turn, honoring that. And I guess someone's telling me there's a term, physical distancing or social distancing. And they were thinking of the actual mechanical term. I guess I was thinking more in the Ontario or Canadian context is that we distance from each other not because we have a dislike for someone, but because we're being polite, as we always do in that. I'll help avoid you if you help avoid me. And that's the same as with the people who want to wear a face covering in the public. It's not that I'm doing it because I'm protecting from you because I'm fearful of you. I'm doing it because I'm trying to show you I'm doing my part to protect you when we can't do the 6 foot distance. So I think that is an Ontario concept and Canadian of social distancing because we think it's the right thing to do with respect for each other. So on the aspects of other documents, we have continued to ramp up the aspects around the long-term care. As you know, yesterday we did have our media event related to the testing with the Premier and with the Minister, and where we've laid out clearly all the directions to our first area priority is to deal with the long-term care and with all the outbreaks and how we move a lot more resources in there and do testing. And that certainly can consume a lot of tests right off the bat. And we're trying to ramp that up over the next week to deal with that issue. And that's the point with more increased testing, is that we're not going to test everyone who wants a test. We want to test people who need a test. And the Premier is very clear on that, and that's what I recommended, and that's what we need to do. So in that sense there, physicians will test people who they feel need to be tested. We're not telling them if and when they can do it. It's the physicians and healthcare provider when they see someone with what they consider as consistent signs and symptoms of COVID-19, and they're concerned about the health outcomes that might direct their care of that person or their situation. They can order the test, and the test will be done, and the test will be processed. At the same time, we want to make sure this new capacity we have, we can really move full force into these areas of priority concern, long-term care homes, retirement homes, group homes, and other residential settings, homeless, as well as to ensure that we have the response we need for our Indigenous communities, especially those in rural and remote. So we're going to be doing a lot more in those areas because that's where we see our main area of concern and priority set at this time. At the same time, we're going to be ramping up our case contact management with our public health units as they continue to add more staff and resources to assist them in this task of carrying us forward, even in the months to go as we face the future ahead. So those are my main comments for today, and I'm going to open up for questions.
We'll take questions from the first caller. Just making sure that the operator is heard. We'll take questions from the first caller.
My apologies. Your first question comes from Carrie Virama with CBC News. Please go ahead.
Hi there, Dr. Williams. How would you characterize the province's response to containing COVID-19 in long-term care facilities, given we now have outbreaks in over 70 long-term care homes?
Well, our response is similar to the rest of the country. We're all really wrestling with this, how this virus impacts these highly vulnerable citizens that are in these institutions, both in retirement homes and long-term care facilities, and where they don't manifest a lot of signs or symptoms. So it presents itself very subtly at first, and so that's why we keep moving up the sensitivities for calling outbreaks. So some of those outbreaks in the 79, and if they go up, as I said, that's because they're calling the outbreak or presumed outbreak very quickly, and we've put in a whole new process for moving fast on cordoning off, doing more testing, even on asymptomatic ones around that case, so we can get a leg up, if you may, on that outbreak, rule it in or rule it out fairly quickly, and try and take actions. Meanwhile, there's other action taking place with ensuring components of personal protective equipment for the healthcare workers who are in those facilities, making sure the staffing is adequate, and how do we deal with the issue of some people working at different sites and different locations so we can cordon it off and deal as quickly as possible. Working with our public health units who have a working relationship with these long-term care facilities over time and continue to increase their capacity to respond at this time of real challenge. And I can tell you on our special advisory committee for the federal, provincial, territorial committees, we had the new guidelines come out just 2 days ago. We're having another meeting this afternoon. And the issues that we're facing here in Ontario are the same as other provinces are facing as we seek to try and find better ways to cordon this off and to limit its impact upon these very vulnerable and valuable citizens of our country.
Follow-up?
Yeah, and I know that Ontario's been consistently testing less per capita than most other provinces in the country. You talked about the need to ramp up testing for the most vulnerable. We're hearing from the mother of a disabled woman with a fever who was taken out of that home in Markham. That was the focus of a lot of media coverage yesterday. And now she's being told by Telehealth Ontario it'll take 3 days to be able to get scheduled in for a test. Like, what do you say to people like that who continuously struggle to even get to a frontline healthcare worker to get that test?
I think if there's a unique circumstance there, if you've tried telehealth, I assume the person probably has a healthcare provider or a specialist who has worked with that person. And I don't know the details, of course, and these ones are always unique situations that are very troublesome and difficult for these individuals. And so what resources can you go? They have the telehealth. They could decide if they can take the person or not to a assessment center. That may not be physically possible. Again, I do not know the details. They could talk to their local public health department to see if there's some other way they might be able to gain some assessment if it's necessary to assist on that grounds, and what further care is needed for that individual depending on the severity of their symptoms, their own personal health conditions, which again I'm not cognizant of at this time. So I would say try those other options by talking either to your physician or physicians, or talk to the local public health to get advice if that would help in that. And I would say navigating this unique and difficult situation.
Next question.
Your next question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Thank you so much. I wanted to ask you a little bit more about the ICU numbers. Is it fair to say that you're less concerned now about ICUs becoming overwhelmed and there not being enough ventilators as you were at the beginning of the month?
Well, yes, and at the beginning of the month, when a week and a half ago, a bit, when we had our modeling projections, even though it wasn't the worst case scenario, the one that was anticipated that we would have a lot more ICU beds consumed or used at this time. And so I think there is some reassurance that we didn't go to that level as of this date. We're looking for some revisited numbers early in the week, and to see have we actually bent the curve even further. And I think, as I said, there's some optimism to see that the numbers today certainly do not show an increase, whereas with all our cases reporting, we would have anticipated that would go up because the percent hospitalizations is based on a lot of the cases, and their ICU admission rate is the same. So I would say that at least tells us that we might be holding the line on the ICU bed usage, which means our capacity that's left in reserve due to the cancellation of elective surgery and other ones means we have some more buffer and resources to go to a bit more. So it may give us some sense of confidence, but I'd say it's still early, and just a small plateau like that, while reassuring, is not yet one of decision making, and we want to see how all the numbers stack up, as well as how do we do over the rest of the weekend.
Follow-up?
And to follow up, what would you take into account before advising that some elective surgeries could start to take place again?
Well, that's on the line of all the other, when would we start to look at different ways of easing off some of the restrictions? And some of the point you're raising there, if we can be convinced that we have, at least at this time, bent the curve and leveled it, if you may, and we have that ability to project that we can, at least for a number of weeks and months ahead, could do that, then some of those elective surgeries, and there's some that are sort of elective and semi-elective, and I know that the physicians out there, including their patients, are feeling concerned about any further delay, and we'd only but want to try and open that back up again so that those elective ones do not become urgent in the future. So there's a lot to be thought through and a lot of decision making before we open that up, and I would say we just don't open it up suddenly to everything. We would have to work with our OH team members to look at how we might do something on that, but that's more looking down the road. As we said from our modelers, they were saying you have to look at somewhere near the middle of next week to see when they had projected we'd be at a peak potentially. So I think we want to put all that into the equation before we make some decisions in that regard.
So before we move on to the next question, I believe that there are some people on the line that aren't in the queue. So I'll just turn it over to the operator quickly to just let you know how to get into the queue if there's a desire to.
Ladies and gentlemen, as a reminder, should you have any questions, please press star 1. Do keep in mind, if you are on speakerphone, lift your handset before pressing any keys.
We'll just wait a few seconds to see if anybody enters. Okay, we'll move to the next question.
Hi, good afternoon, Doctor. My question is the province considering any financial support to kind of stand behind Health Canada's new guidances to limit the amount of facilities healthcare workers work at?
Well, I know that in this issue and across Canada, each jurisdiction is dealing with this issue where we have a number of part-time staff who work at a number of facilities, how we might come up with a rectification of that, depending on the different situations in each province, with working with the Ministry of Labour, working with our counterparts in Ministry of Long-Term Care, and of course, if you're dealing with retirement homes, is a different issue altogether, and how we might shore that up and deal with that problem on a fairly urgent basis. So we have a number of things being looked at this time, and how we might do that, and in a way then limit the amount of movement on there, at the same time respecting the role of our workers in those long-term care facilities, which we do depend upon, and we do want to make sure that not only that they're respected in this regard, but also protected with proper management of our outbreaks and the provision when always necessary with personal protective equipment.
Follow-up?
And can you kind of summarize the province's stand on healthcare workers working at multiple facilities? Like, where does the province stand right now?
I think, as I said, the province stands one is that we value those workers because they're essential for the care in our long-term care facilities, and we want to understand that before we make any decisions, because we want to make sure that the staffing in those long-term care facilities and the care they give to these very much needy residents is going to be there. And that means a combination of respecting them in their workplace and their role, making sure they have the proper education, resources, and supports if there is an outbreak from the province, from the various sectors, including from the local public health units, and then to make sure that they have adequate testing quickly to rule in and rule out not only the cases in the home, but also to make sure the resident or the staff working there have been tested and they're safe, as well as providing proper personal protective equipment. So it's a combination of a number of things. So our stance is that these are valuable workers, they're necessary workers, and it's necessary that we keep them healthy and well, and to support them as they support these residents in these facilities and the families who put their loved ones in those locations.
Okay, I don't believe there's anyone else on the line, so thank you everyone for joining us.